Joey Ortiz is a 28-year-old student at the University of Arizona, and he's already part of history. He has closely followed news about the pandemic, and when he heard several months ago that pharmaceutical companies needed volunteers for a coronavirus vaccine study, he signed up.
I hope my participation accelerates the end of the pandemic.
Ortiz has a master's degree in physics at U of A, and he's working on his second master's in systems and industrial engineering. He studies decision-making under mathematical uncertainty, and he used those skills to research the likely risks connected to an experimental vaccine by Moderna, an American biotechnology company.
There was a study that it protected rhesus monkeys. There was studies showing that it generated a strong immune response, similar to convalescent patients, people who had recovered from the virus. And I was very impressed by what we did know about it.
Some people would say you deliberately became a human guinea pig of sorts. You had no problems, no qualms with doing that?
Well, unlike guinea pigs, humans provide consent, and consent is a huge part of participation in any trial.
At Quality of Life Medical and Research Centers in Tucson, Ortiz had blood drawn to see if he had already been exposed to the virus. He had not and was accepted into Moderna's Phase 3 trial of the vaccine.
There's many other people there doing the same thing I was. I think I noticed one person was a teacher. Yeah, I definitely felt camaraderie with the other participants.
Ortiz received 2 injections, 28 days apart. He doesn't know if he got the real vaccine or a placebo, a saline solution.
I think I was tearing up a little bit when I was receiving the vaccine or the placebo. And I felt a lot of pride towards the study administrators and just everyone involved. I was hoping to get the vaccine, and I was a little disappointed to not have side effects.
Okay.
But I'm still happy to participate and help the science determine if the vaccine is safe and effective.
Moderna's Phase 3 study involved 30,000 volunteers, 18 years old and up, across the United States. From the total number, 7,000 were over age 65. 5,000 were younger than 65, but had high-risk chronic diseases like diabetes or severe obesity. And more than 6,000 were Hispanic or Latino, like Ortiz.
I'm young, so my risk of serious infection is pretty low. But I have parents that it's not the same for. I have friends whose parents have been hospitalized.
You said you have a father who is high risk. Can you tell us about that?
Yeah, my dad's a 70-year-old male, like many people's dads, and I would like to see him after the pandemic's over quite often. And I think, we all have loved ones that are at high risk. I did it because it felt like a smart decision, something that was probably going to work in my mind.
Would you consider it more scientific than emotional, or a combination of both aspects?
It was a combination. Scientifically, I was pretty certain that I was making the right decision. Even if it was more uncertain, I would have made the same decision just on the basis of helping end this disruption in our lives. I'm mitigating the risk of seeing my parents for the first time since the pandemic started. I'm quarantining, getting a test, and hoping I don't infect them when I see them. And I think I have a good handle on how to do that safely.